Good morning. I got a request from one viewer to look at some of the northern states. And I did note in the last videos I was looking at Florida, Texas, New York City, and New York State minus New York City. That obviously misses a whole bunch of states and a whole bunch of areas, excuse me. Oh, and California. I was just picking the largest states by population, and that misses the Midwest and the North. There is an issue with touching on some of the northern states like Idaho, Montana, North Dakota. They have so few, so few people, or like Alaska. I actually would have to aggregate these particular dashboards. Wouldn't be very helpful. However, some of the northern Midwestern states, such as Minnesota, Michigan, and Wisconsin, obviously, are pretty hefty states. And then we have Illinois. I don't really want to look at Indiana, but I can do that. So let's start with Michigan, and I'm going to start with the total deaths, and we're going to look at cause of deaths. Michigan had two spikes, so one in the spring, and that was really centered in Detroit. And no, it's not coming from this dashboard. This is just knowledge I already have. Then there was another, and we can see there's another wave that it looks like maybe it peaked mid-December. It kind of depends on how much of a lag they have on reporting, and I'm not going to worry about that right now. So let's look at Minnesota. Okay, so Minnesota did have some extra stuff going on in the spring. Okay, and it would be interesting to see if that was centered around St. Paul, Minneapolis, obviously. They had that big winter wave as well, and it looks like that peaked kind of mid-December. And again, it depends on the lag in reporting. Obviously, these weeks here into January I'm not expecting those to be the final counts. Let's find Wisconsin. So Wisconsin, you'll see these little pluses, and that means there is excess mortality, but you'll notice that it's not really a peak. Remember, part of Wisconsin, so we've got Milwaukee, it's not too far from Chicago. You could say parts of Wisconsin are essentially suburbs of Chicago. So I could see that some of that excess mortality that we're seeing in April through the summer is coming out of Illinois. That said, they get their wave, they get their spike. It looks like it may have peaked a little earlier than the other states in November. Maybe this again has to do with reporting lag and that some of the December and later November dates will come up, but that might not be the case. Actually, let's just do the with and without waiting and see what these look like. Okay, yeah, so it may be due to the reporting lag. Their peak may still be in December for Wisconsin. And let's look at Illinois. So Illinois did have two waves. We had a spring wave, again, probably centered around Chicago, and then we had a winter wave throughout the state. But we can see there is some lagging in reporting. Maybe that peak is mid-December like those other states, but maybe not. And I'll do Indiana. What the hey? Okay, so here's Indiana. Ooh, okay, so yeah, for Indiana, there is a big lag compared to the other states we've looked at so far. They had a spring, and it kind of, just like with Wisconsin, of course, Indiana is right next to Illinois, and a lot of people live in Indiana, work in Illinois because of the tax differences. In any case, so they've had elevated mortality throughout, but they did get that winter peak. And let me just show you the Dakotas. Let's start with South Dakota and then North Dakota. So South Dakota, boom. Okay, yeah, there was a real spike there in South Dakota. So you can see there's some noise because it's relatively small, but it's hard to miss that wave. So there's South Dakota. Heck, let's look at all of the states that I can remember. North Dakota. Yep, you can see that coming through the fall and coming up. I have enough of a population for this to do something. Let's try Montana and Idaho. I'm just curious. Yep. Okay, so Montana is similar to North Dakota. It's coming up, and it's a little noisy, and there is a lag in reporting, which is what I would expect. Let's look at Idaho. Yeah, now, so Idaho, we see that there's some elevation that goes in the summer, and then definitely a winter wave. Let's see what else we've got. Let's try Wyoming. Yeah, Wyoming, it's just kind of low. And yeah, we do have excess mortality. Ah, this is interesting, this January spike. I wonder if in the early days, and we can see there's a lot of excess mortality around here, but I'm not quite sure. I assume they will record out of staters who come into Wyoming and then die in Wyoming. Remember, there's a lot of skiing there, and you get people coming from other places, but that's, kind of a high spike. And if you remember, a lot of the early COVID was spread through skiing resorts throughout the world, mainly Europe and then maybe in the US, who knows? But definitely in Europe, like in the Alps. Let's see. Oh, let's do Washington State. What the heck? Yeah, that's kind of not really much going on. Look at Oregon real quick. Yes, a little bit elevated, but not much going on. Let's see. Let's do Nebraska. Okay, so Nebraska didn't, they just a little bit bubbling early on, and then they got the winter wave too. So their peak, yeah, that's end of November. And again, this may be due to the lag in reporting that more of that will be coming up soon. But who knows? Let's see. Are there any other ones? I want to look at not Texas again. Sorry, that was a mistake. Utah. I just want to do Utah for a moment. Utah actually skews a little younger than other states, thanks to the Mormons. Um, so yeah, maybe that's August, so some of the summer wave, but then we've got the winter wave going on. Winter wave occurred pretty much everywhere, not New York City, but that's just kind of relative. New York State, it occurred pretty much everywhere. So for the following, when I get into, let's go back to, Michigan. I want to get into cause of death. Just as we saw with Alzheimer's and diabetes, let's go to the group, update that dashboard. We get the whole United States. Okay, so there was that lump for respiratory diseases, a little bit of a spike. For circulatory diseases, and elevated through the summer. It's hard to tell in the winter. There's a seasonality to circulatory diseases to begin with. Cancer is pretty flat. Alzheimer's had a spike and then some elevation in the summer, and it looks like elevation in the winter as well. And then other select causes. I'm going to go into the subgroup because that's where we can really focus in on where all of this is coming from. A lot of the respiratory diseases, it's just that it's undiagnosed COVID. Circulatory diseases, again, remember, it's heart attacks and hypertensive diseases. The other ones, heart failure, cerebrovascular, other circulatory, it's pretty flat. Malignant neoplasms, we've already seen, that's cancer, that's flat. Alzheimer and dementia, this is one that's kind of elevated throughout, and we get the same for diabetes. So the question here is, these are kind of chronic conditions. Is some of this underdiagnosis of COVID? Are there other things going on? Well, let's see. Let's go into Michigan. We're going to start with Michigan. I'm going to do the other upper northwestern states. And we see there's like this spike in diabetes. A lot of noise. I will do an analysis later. What I have to do basically to get rid of a lot of this noise is I have to aggregate the deaths by causes over all of 2020. Let's just do all of 2020. Let's just ignore 2021 for right now, and then do some comparisons state by state, different locations. Let's look at Alzheimer's for Michigan. So we have, again, an initial spike in the spring. Remember, in Michigan, they also had kind of a nursing home situation as well, where the governor there, and it wasn't that unusual in that first wave because of concerns over hospital crowding or, et cetera, that they sent people out of the hospital back into nursing homes when they didn't need to be hospitalized, but while they were still sick and obviously still infectious, and infected other people in the nursing home. So we had a spike there, and we see it was elevated for the winter. And just to check, we'll look at cancer. That's pretty flat. Circulatory, boom, that heart attack, is that underdiagnosed COVID? Hypertensive, notice it's a little elevated throughout, and I don't think that's necessarily COVID underdiagnosis. And then let's just do respiratory. Okay, so we have a spike. Again, that's probably COVID deaths, not flu and pneumonia. Okay, so for the rest of these, let's just focus in on diabetes and Alzheimer's. Okay, and we're going to do Minnesota next. Yeah, that is just too noisy. It does seem a little elevated in the winter, and these weeks are early summer, late spring, I believe. I'm not really seeing, it's a little elevated, but again, I would have to aggregate it to really get into that. That was Minnesota. Let's do Wisconsin. Okay, Alzheimer's, this does seem to be pretty elevated throughout, especially in the winter months. Let's look at the other select causes. Whoa, okay, yeah, elevated diabetes. But again, notice this, these are weekly counts, and this is like on the scale of 40 per week versus 30 some per week. Let's see, 45 versus 47. Are you kidding me? Oh, that's week number 47, sorry. 31.2 deaths versus 42 deaths. You know, that, and this does look statistically significant. When I aggregate it, like the under is not that under. There will be excess diabetes. It's interesting, kidney failure, we're not seeing that so much, so people maybe not missing dialysis. That's great. But it is interesting. Is it that they really are dying of diabetes, or they actually died of COVID, but it was known they had diabetes, it wasn't known they had COVID? Okay, I'm sorry. Alzheimer's. Yeah, it's elevated. And then let's just do Illinois. We see it elevated here. That is, and it's meaningfully elevated throughout. Again, is it under diagnosis of COVID deaths, or is there something else going on? And that may be the case. It may be that care for those in nursing homes deteriorated as there is lockdown, so that would have a social effect on the patients. But policy changes just may have made it worse for them. And yeah, diabetes is looking pretty bad in that spring and winter. Again, I don't know if it's underdiagnosis or if people are not getting properly treated, or they're not keeping up because they're very stressed. That's the other thing. Maybe they're following their normal protocols, but they're so stressed out about the current situation, it makes their situation worse. These are all possibilities. Actually, the last state I want to do is South Dakota. Yeah, so this is where I'm starting to get into problems. The problems is you look at the scale of how many deaths per week. When you saw other causes, notice they didn't have renal failures and sepsis, because even with diabetes, they have this is pretty flat. And it's questionable to me about how many real data points are on this line. They may not have enough data to actually record this well week by week. This is just too low. I can get the data aggregated for the whole time period. And yeah, this is just the problem in going into this. Let's try Indiana. So Indiana, we do see some excess for Alzheimer's throughout the time. And if we look in diabetes, yeah, that's excess as well. So it is interesting. We really need to dig deeper into these causes for diabetes and Alzheimer's/dementia to see, did they really die of this? If they did, why was it elevated during this time of pandemic and lockdowns? Was their care substandard in some way? Or, you know, was it just that these are comorbidities that you are more likely to die from COVID if you have diabetes or if you have dementia for whatever reason? And because it was known they had those conditions, but it wasn't known that they had COVID, this was recorded as the ultimate cause of death. Don't know. Um, we are going to be mining this data for insights for years to come. Um, it is, I'm just letting you know, in normal years, we take over a year to just process the data to get it in a form that researchers can use in a reliable way. The CDC did not release the final death numbers by cause, etc., for 2019 until December 2020. And that was actually a little fast for 2019, come to think of it. I'm just trying to remember how long I usually have to wait for those final death numbers. Usually I'm thinking I'm getting the preliminary death numbers in like November or December of the following year, and then I have to wait into the spring of the next year to get the final. But I could just be misremembering. A lot of these schedules that we've been on, census data, CDC data, all different kinds of data that need a lot of cleanup because this is the thing that I keep mentioning, and I mentioned in prior videos, is you need to think about how the data are created, how they're collected. Why do they need to get cleaned up? For something like this, so whether someone died or not, that's fairly simple. Age at death, well, maybe you have a good date of birth on them, maybe you don't. Race, ethnicity, and sex, those can, well, sex probably not, but race and ethnicity, uh, you know, this is one of the issues behind Hispanic death rates. People have been wondering for a very long time, how real is it that white Hispanics seem to have longer life expectancy, lower death rates, et cetera, for the same age, et cetera, compared to non-Hispanic whites. Or just Hispanics in general, no matter the race, have lower. And one of the questions is our count of the numerator and denominator are based on different things of how many Hispanic people died versus how many were alive at a certain point. And that's how we have to figure out our death rates. These are not necessarily, race and ethnicity is generally self-reported for census surveys, but when you're dead, someone else is going to identify your race or ethnicity for you. And it may be based off of what you have down from an official ID, if you have an official ID, and it's not necessarily recorded on the official ID either. So that's just something to think about. Cause of death, and I understand people wanting to argue this. I don't want to argue this. But obviously, it's not like going outside with a thermometer and taking a temperature. A human being had to have used judgment to write down a cause of death. There was always, not always, there's usually more than one cause of death on a death certificate. In my own just mining of the data, the number of causes of death on death certificates has been increasing over the years, with an average about 3 in recent years. There can be only one underlying cause of death, and you can have up to 20 contributing causes of death. And it's not science or anything like that. That's just what the form is like from the CDC on the death certificate. It's very unusual for anyone to have put up to 20, and that's why they put 20 in there. They figured not many people are going to have 20 causes of death on their death certificate, and I'm not really expecting it to go more than 10. I don't know all the decision trees that go into determining what the official cause of death is on the death certificate. In all the cases, death is your heart stops beating and won't start again. So heart failure can always be the cause of death. You're not allowed to put down old age as cause of death anymore. That's been for decades that you've not been able to do that. But for example, with Alzheimer's and dementia, for increasing, and it is an increasing official old underlying cause of death for people, how much of this is due to you're not allowed to put down old age and someone had Alzheimer's or dementia, and then you just say, well, that was the underlying cause of death. I don't know. It's like, I don't know how they decide, but humans have to decide. And we're not going to get away from that. Okay? So just deal. There is a certain amount of uncertainty and there's a certain amount of mess in the data we have to analyze. That's just reality. In any case, lots to dig into here, even with what I would consider a relatively sparse data set. Okay, more later.